Hello, my name is Tana Shea James, and for my journal club, I will be focusing on global reproductive health. The title of the paper I chose to review is called Reproductive Health Evaluating the Effect of Maternal M Health Text Messages on Uptake of Maternal and Child Health Care Services in South Africa, a multi center cohort intervention study. So the study was done in partnership with the Johannesburg Department of Health, and the study was funded by the Karolinska Institute, Johnson and Johnson, and the Vodacom Foundation. The purpose of the study was to evaluate the effects of mobile health intervention on the uptick of maternal health services. The researchers approached the study with high expectations. They believe that mobile health or M health strategies will increase uptake of healthcare services, especially in resource strained settings. A few keywords that I will use are the expanded program on immunization, or will be shortened to EPI. Antenatal care will be shortened to ANC, and postnatal care will be shortened to PNC. Okay, so the study setting, so this was a multi-center cohort intervention study which ran from May 2014 to June 2015 and included maternal infant pairs recruited from 6 participating public health care facilities offering ANC, PNC, and EPI services in the inner city of Johannesburg, and Hillbrow, which are urban neighborhoods in Johannesburg inner city. So these neighboring areas have very high population density. They're predominantly low income and have high rates of alcohol abuse, gender-based violence, unemployment, which is estimated to be at 23% in 2013, and a positivity HIV positivity rate of 27% among pregnant women in 2013. So there are 16 public healthcare facilities offering ANC, PNC, and EPI services in the inner city of Johannesburg, and Mobile Alliance for Maternal Actions, or MAMA, was offered in 6 of these. So among these 6, there 3 were selected as intervention facilities, and another 3 were selected as control facilities. And from the 10 not offering the MAMA intervention. So all sites provided standard ANC and PNC services to study participants and were purposely selected based on their patient/client similarity and proximity to each other. So the intervention consisted of twice weekly informative and pregnancy stage based maternal health information text messages, which were sent to women during pregnancy until the child was 1 year of age. The purpose of the study was to assess if a maternal health intervention using informational maternal health text messages timed to the stage of pregnancy and the age of infant was an effective strategy to increase rates of antenatal care attendance, EPI coverage, and comprehensive maternal, neonatal, and infant care in inner city Johannesburg, South Africa. The study, during the study, they collected socio-demographic data were collected during participants' interviews. ANC attendance data were collected from clinical ANC records, and EPI coverage data were collected from infant RTH booklets. So that's their immunization booklets. The study data were then digitized and stored using Research Electronic Data Capture, or RECAP. So RECAP is a secure web-based application designed to support capture for research studies. For the intervention, free one-way text messages were sent twice weekly throughout pregnancy and for 1 year postnatally. The text messages contain supportive and informative information times to the stage of pregnancy and age of the child. And they were sent as part of the Mobile Alliance for Maternal Action South Africa project. The message content was initially drafted by Baby Center UK and was then customized for the South African context by a team of local maternal and infant professionals. So the messages sent covered a range of message content. Messages were sent at 23 weeks of pregnancy, and the message uh, said you need 4 clinic visits in pregnancy. A visit may take all day, so get a letter from the clinic for your work. It doesn't have to say that you're pregnant. At week 32, the message that was sent, um, going to your clinic appointment is important for you and your baby. Even if you feel healthy, please go. Remember, you have a right to ask questions. At week 35 of pregnancy, the message indicated that breast milk is the best food for your baby. It should be his very first food as soon as he's born. Your milk helps protect him from infections. At week 5 postnatal, so this is after pregnancy or delivery, you should have a Road to Health card for your baby, RTH card. Keep it safe and take it whenever you take your baby to a clinic, even if you've moved. At week 6 postnatal, vaccines help prevent your baby from catching diseases. Each vaccine needs to be given at the right time. The first ones are due at 6 weeks. And at week 11 postnatal, it sends a HIV message, which indicates that if your baby tested positive, HIV positive at 6 weeks, make sure you get him to a clinic for treatment. If treated early, he will do very well. Okay. So when it comes to M Health interventions, it is very important to note that when implementing maternal M Health interventions, that there are no guarantee that they will work. You must be willing to customize your study to fit the needs of your target group, and you must research your target group. Target group. Okay, so while you research your target group, there are a few key points that you should look forward to, such as their literacy rate, mobile phone ownership or accessibility. Would the intervention be cost effective? Would the intervention be a cost effective strategy for boosting ANC and EPI attendance? So those are a few questions that you can ask yourself prior to implementing an M Health intervention. So the result of the study found that the study participants were more likely to attend all government recommended antenatal and postnatal visits, all recommended first year vaccination, and they also had a higher odds of attending at least the recommended 4 antenatal visits. Okay. And once the study concluded, it was shown that there was an improvement in achieving a complete maternal infant continuum of care, providing evidence of a positive impact of informative maternal M Health messages sent to pregnant women and new mothers. Thank you.